paper was a result of a multi-institutional collaborative effort to explain the differences in susceptibility to and progression of disease that has been observed with SARS-CoV-2, or the virus that causes COVID-19. This pandemic is characterized by infected patients either being asymptomatic or severely ill, requiring hospitalization, perhaps even ventilator or temporary mechanical circulatory support. Hi, my name is Naveen Pereira. I'm professor of medicine at Mayo Clinic, Rochester. I'm a consultant in the Department of Cardiovascular Diseases. And today I'm going to provide a brief overview on the manuscript that we wrote together, COVID-19, Understanding Inter-Individual Variability and Implications for Precision Medicine, that is already online on the Mayo Clinic Proceedings website and will be appearing in the February 2021 issue. Understanding why these differences occur would be helpful in targeting the right patient for the right therapeutic intervention, whether it is administering vaccines or providing drug treatment or admitting patients to hospitals and resource utilization. Knowledge of these differences also is critical while designing clinical trials to demonstrate efficacy of therapeutic interventions being tested. For example, trials that enroll patients who had low risk for progression of disease may not have adequate number of events, and hence these trials would be underpowered to demonstrate significant differences with a therapeutic intervention. We may have observed this phenomena in the hydroxychloroquine clinical trials. There are demographic and biological differences in populations exposed to the virus. And more recently, we have observed differences within the viral genome itself that may explain variability in the transmission and clinical course of COVID-19 disease. From a demographic perspective, older patients, males, race or ethnicity such as American Indians, Blacks, Hispanics are more likely to be hospitalized and have severe illness. There may be biological reasons why these demographic groups appear to be more affected than others. From a biological perspective, there are various factors such as expression of ACE2, the receptor that facilitates entry of SARS-CoV-2 virus into the cell. Increased expression of ACE2 is observed in males. And on the other hand, children under the age of 10, a large proportion of whom are asymptomatic or have mild disease, have the lowest expression of ACE2 receptors in their nasal epithelium. Having the extra X chromosome in females appears to be beneficial since there's increased expression of toll-like receptor 7 that is present in lung tissue. And that receptor facilitates production of large amounts of interferon that can interfere with viral replication. Conversely, having loss of function genetic variants in the toll-like receptor 7 gene can result in impaired interferon response and thus lead to more severe illness. An interesting study demonstrated that individuals who possess the Neanderthal haplotype may account for the differences seen in the severity of COVID-19 amongst the various populations around the globe. Blacks, Hispanics are more likely to be hospitalized and have severe illness. There may be biological reasons why these demographic groups appear to be more affected than others. From a biological perspective, there are various factors such as expression of ACE2, the receptor that facilitates entry of SARS-CoV-2 virus into the cell. Increased expression of ACE2 is observed in males. And on the other hand, children under the age of 10, a large proportion of whom are asymptomatic or have mild disease, have the lowest expression of ACE2 receptors in their nasal epithelium. Having the extra X chromosome in females appears to be beneficial. The powerful impact of variability in genes on COVID-19 disease was demonstrated in a large genome-wide association study that linked differences in genes that were related to antiviral defense mechanisms and the inflammatory response. And they linked these genes to critical illness and COVID-19 disease. The discovery of these genes could lead to precision medicine approaches in genetically susceptible individuals. Finally, harnessing the power of artificial intelligence and machine learning to effectively integrate the vast amounts of clinical, demographic, and biological data, including information that could be obtained using digital technology, such as smartwatches or smartphones, to ultimately develop predictive algorithms for COVID-19 disease susceptibility and progression, would help recognize that individual differences occur, and this recognition will help improve health for all using precision medicine. If you would like to further explore the fascinating reasons as to why we are so different when exposed to the COVID-19 virus, I would urge you to read this comprehensive review. And I hope this manuscript inspires further research and ultimately improves patient care. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.